Welcome once again to Better Black Health, brought to you by Genetic Sequence Multivitamins, still the only multivitamins made to address the unique nutritional needs of African Americans. In the Better Black Health book, on sale at bookstores all around you. So you guys know fibroids affect up to 80% of Black women by the age of 50. And all the women in my world, that's fibroids have affected. Yet many are told to just live with it. It happens to so many people. Or have a hysterectomy like my mother had as the only option. So today we're going to be talking to one of the country's leading fibroid surgeon, probably the leading Black fibroid surgeon, Dr. Pierre Johnson, known as the Fibroid Slayer, about what women need to know, what the medical system frequently gets wrong, and why preserving fertility and a woman's choice matters. He recently removed a 27-pound fibroid and received national attention. Man, 27, think about 27 pounds. That's big. From a young age, he set his sights on becoming an OB-GYN and persevered through significant challenges to fulfill that vision. He earned his bachelor's degree from Xavier University in Louisiana, where he also pledged Omega Psi Phi Fraternity. I'm not going to make any noises right now. He went on to earn his medical degree from the University of Illinois at the College of Medicine, complete a general surgery internship in Washington Hospital Center, and complete an OB-GYN residency at the Southern Illinois University School of Medicine. So let's welcome Dr. Pierre Johnson. Welcome, welcome.
Thank you. Thank you. Pleasure to be here, man. Thank you so much.
All right, we appreciate having you. So these fibroids, they're everywhere. So tell us what if we got some men listening or women that don't know, what are fibroids?
Fibroids are just kind of benign growths of the uterus. Almost look at them like calluses of the uterus, if you will. People rave about like how they come from. We can have benign growths everywhere because it's the uterus. It becomes more sacred and more fearsome, if you will. But we have benign growths. We have skin tags. We have calluses on your hand. You have all types of things that can grow abnormally, and this is really no different. It's just a benign growth that can happen on your uterus. The reason they're so huge, and I don't mean to minimize them, is because they can impact fertility, and they can also cause a significant hindrance in the quality of life of women.
Right. Does it make their periods harder and longer and more painful?
It can, but they also can be there and do absolutely nothing. They also can be there, and women can live with them for decades and no idea that they have. Majority
Right.
of women that they experience them and they don't really aren't symptoms from. If you will.
From anything in particular. Why
Yeah.
does it occur disproportionately in Black women? And what's the ratio in terms of what's the ratio affect 80% of Black women? What percentage of white women have fibroids?
So it's 70% in the general population.
Okay, so
You
they're
know,
common a lot,
they're
but
common
Black,
all over.
okay, but
Yeah, it's
Black
common
women.
all over. Women. So I'll say Black women. My experience, Black women experience more advanced disease, if you will.
Mm-hmm. So
Larger,
bigger fibroids.
bigger fibroids, more numerous fibroids. Right, those cases, Black women experience more than any other. That's the biggest part.
Is there an issue with making the diagnosis too late? I mean, is there something that like is there something we're missing? Like, used to do pelvic exams and and ultrasounds and whatnot, and there's fibroids. Oh yeah, you had fibroids. Is there something that primary care doctors or some GYNs are missing in terms of they see them in Black women, but they're missing an opportunity for something?
I think it's more so if you look at the cultural aspects of medicine and understand the history, women's, this particular Black women, apprehension with the medical system, doctors, and not being forthright with sometimes giving the symptoms, knowing that probably they're going to get news that they don't want to hear. Some of these surgeries were used to weaponize against Black women for centuries, and so some of
Right.
that mistrust in the system, gets women to not be upfront about those things. And then you add into the fact of the cultural relevance of, have been behind, for all this time, and now we're now starting to be able to have advanced degrees, and black women are advanced more now were. And so they're putting families off later. So when you add in chronic stress and everything else, and the mistrust of the system, lack of access to care, poor foods and all of the other things, and then you look up now, you've done all of the things and accomplished all of the things, and now you're in your late 30s, early 40s, trying to have a family. It's a lot of times it's morphed, and the advanced disease happens when you add in all of those things and factors.
Right. So as you get older, many times the fibroids grow, and I've even told people when they get, they get perimenopausal, and black women tend to go through menopause on average couple of years earlier, that if they could hold out, then maybe the fibroids won't be as much of a problem. Is that actually true, or am I wrong on that?
Well, it depends on what the symptoms are. All bleeding is going to stop every woman. Whether you have fibroids or not, you are going to experience menopause. Bleeding will stop. Not the only thing it can cause with intercourse, pain, pelvic cramping and pain, frequency of urination just from the size of fibroids. And so if you're having bulk symptoms just because of the size of fibroids, that's not going to change with menopause. The bleeding may stop, but
Mm-hmm.
if you have a 20 centimeter fibroid, it's not going to change into a 2 centimeter fibroid just because menopause happens. You're still going to have a excessively large fibroid even with that.
Right, right, right. I had a woman who was in her 70s, and they thought she had some massive colon related cancer. And when they went in and did the surgery, because it was so big, they found it was a really big fibroid. And she was planning for her death, and getting her affairs in order. And
Yeah.
all because this thing showed up on the CAT scan, and she was in her 70s, so it wasn't
Mhm.
it wasn't no one was thinking about fibroids and it was
Yeah.
really till after the surgery that's what it was. She called it. Looks like I'm
Yeah.
going to live. That does that happen more often than we know?
She was living with that for 30 plus years. It's been there. It didn't start overnight. She was for an extremely long period of time. A lot of the
Hmm.
times what I see is, it's an incidental finding. You get an ultrasound, CT scan, MRI there. If you don't know how to counsel patients appropriately, you don't know how to manage it appropriately, a lot of times, unnecessary surgeries are done, when other options can be, utilized.
Right. So you're not seeing bigger fibroids in black women. You're seeing bigger fibroids in older women. Is that what you're saying?
No, not necessarily. I have women in their 20s and early 30s with big fibroids. I'm just speaking from a generality standpoint,
Hmm.
why it is many of us, it's more so a overwhelming majority of my patients are in their, mid to late 30s, early 40s, but that doesn't mean I definitely have some younger patients, but just looking at the broad scope of why it can impact, a culture so heavily. And I think it's because of those issues that I discussed.
Right, right, right. So now we've talked. I've been interviewing people. They talk about how hypertension and diabetes can be from inflammation, right? And
Hmm.
inflammation from cortisol release and oppression. Just kind of living black in America, right? And that causes, no question, causes increase in hypertension. No question, causes increase in diabetes and lupus, fibromyalgia. A number of things, but there's no evidence that shows that having a disproportionately increased fibroid is related to any of that. Is there?
I believe it. I wholeheartedly believe that, because the things that we do know about fibroids is that they're coded by genes. It's just very
Mhm.
prevalent fibroid genes. And when you have abnormal coding of genes, that's when you have growths happening. How does that happen? When you
Mhm.
have stress, when you have environments that are optimal, you get this abnormal coding of these genes. And so I definitely think stress has a lot to do with it.
Yeah, yeah. I would be. Yeah, I was going to be surprised if you said no, but I didn't know. I
Yeah,
mean, it's like
yeah,
it's
yeah,
it's a, I'm an internal medicine doctor, so what do I know about these things?
yeah.
But so are we missing? What are we missing in terms of? Is it related to diet or exercise or overall health? I mean, are we missing something? Because that, diet, exercise, and overall health, it also contributes to hypertension and diabetes. Does
Sure.
that in some way? Do you see bigger fibroids and bigger women, bigger, less healthy women, or no?
No, and we want to put that we in medicine, like we want to have everything, we want to have answers, but some things
Mhm.
don't have as ready of answers as we think that they should have. For instance, when we have, you know, 30 something year old, 40 something year old people that just have cancer out of the blue. Yeah, you could say it's food, but there are this multifactorial that reasons of why fibroids are really, no different. The truth of it is I operate on vegans, vegetarians, health experts, right? It
Mhm.
shows no mercy to those
Mhm.
things. And I tell people all the time that yeah, you should eat healthy, have a healthy lifestyle, should exercise, should do all of these things for your general health. But the myth of if you do these things that you can eradicate fibroids, or if you have bad fibroids, you haven't done these things. That's the
Right.
biggest misconception because it almost shames women. So it's like, hey, you did this, or something that you did to cause it, and it's not the
Right.
case. Like walks of life, women that I've operated on, from healthy to more unhealthy, and even cultural. I've had, I can't say all black women. Caucasian women, Indian women, Asian women that have come in with very large fibroids as well too. So it doesn't. It's not a racially, motivated thing to where it's just like hit us. It just hits us more, if you will.
Right, right, right. And there's not like an environmental thing. I grew up in the city near a number of factories, and people had asthma, whereas people grow up not around factories have asthma. Is there any environmental issues that's not something that's driven by the woman, but just living in the city gives you more fibroids, or living near factories give you more. Is there an environmental issue of it?
I don't think so because, to that point, I have women all over the world that reach out to me. Women that fly
Mhm,
here from Great on Women from Norway, Finland,
mhm,
Nigeria, Canada, all through the Caribbeans, like there, for surgery. So, I can't pinpoint it on a region or area
mhm,
either. But, to that point, I would say that it's still some form of melanin based type deal because I have a very large African population that has advanced thyroid disease too. So there's something to that point where melanated women have more propensity to developing advanced thyroid disease. Yeah.
do they also tend to have fibrocystic disease? I mean, do they have more fibroids in their breasts? I mean, I know I've seen lumpy
Nope.
breasts. I mean, there's no
Nope.
association of that at all.
Nope. I have women that have had issues with fibrocystic breast issues, but there's really no trend in that. That's not a over
Mhm.
majority of women.
Yeah.
It
So
changes
let me
other
ask,
places.
so what they did for years, certainly since I've been a doctor, is someone came up with fibroids that were too much of a problem. They gave them a hysterectomy. Is that an overreaction?
I think it is an overreaction. It is really the thought that we have a subjective input there's of what women should do, and I hear it from doctors too, that are field that just say, hey, she should just have a hysterectomy. And like, how do you say that without hearing what she wants, hearing what her situation it is? It's very easy for you to say that if you have children. You had, mid 30s, late 30s, she has advanced fibroid disease with no children, and you're telling her that she has to have a hysterectomy. That's the most insensitive thing that you can say. You just really have to, when we create plans for our patients, the first thing we should be asking them is what are their goals? Like, what are you trying to accomplish first? And then we
Mhm.
can talk about what treatments look like from there.
Right, right. And now when someone actually gets pregnant, and say their fibroids have been not a big issue, but a bother, and then now they're pregnant. what sort of risks are there associated with having a successful pregnancy with fibroids?
Women can have successful pregnancies with fibroids. So
Yeah,
the,
right,
the overwhelming majority of women are getting pregnant, having babies with fibroids. Now it becomes a little bit more difficult if they have advanced disease where you have very large fibroids or even
mm-hmm,
fibroids that are pushing into the cavity of the uterus. That can cause some pregnancy complications.
mm-hmm,
But women can absolutely get pregnant and have a successful pregnancy with fibroids. But that's within reason. It just kind of really depends on the size and the location of their fibroids.
right, right, right. And so there's not, if you have fibroids, you shouldn't worry about whether you can get pregnant and have a successful woman. You're saying people have been doing this for since the beginning of time. So
Yeah.
speaking of the beginning of time, are we seeing more fibroids now than what we saw in 1980, for example? I mean, in the last 50 years, are women in general getting more fibroids, less fibroids, or it is what it is?
I don't believe there's a significant change, but I do believe there's a difference in approach. Just as a society, we've changed significantly, uh, not only with life expectancy, but also with how we live our lives. You look 60, 70 years ago, women were just in the house, makers didn't have opportunities for, advanced growth, outside home. Now that's completely different. And now they're, doing things that, they weren't afforded 60, 70 years ago. To that, you look back then, it's like, hey, you have bleeding, have any issues, hysterectomy. You've had your kids, it's over with. Done.
Mm-hmm.
Where now you have women that haven't had kids and are doing other things, are professionals, or even breadwinners of the house. And so
Mm-hmm.
now it's like, hold up, now we have more issues because she didn't have a hysterectomy 10 years prior. She now is trying to preserve her fertility to have children. So we see more issues because it's handled and managed differently now just because of our social climate.
So it makes sense if you if someone listening has, they said you got big fibroids but not oversized, and they're, I mean, should a fibroid just come out because it's there?
No. And the term big really, you have to realize that's real. Just speaking to women, like when someone says something is big, it's relative. So just like for instance, somebody that's been driving or just been riding bike their entire life, if they into a Yukon or a Tahoe, they say, hey, this is a big truck. Whereas if
Right,
you've been driving Yukon Tahoes all the time, it's, hey, it's a regular vehicle. So it's that term and the assessment is based on the experience and the comfort level of your doctor. If your doctor's never seen a large fibroid, then a 5 or 6 centimeter fibroid may be very big to them. Over
right,
six
right,
centimeter fibroid to me is like a pimple. So
right,
it just depends on who you're talking to and in the context of which they're talking.
right, right. Well, you had a 27-pound fibroid, so that's, babies are born. My youngest son was 11 pounds, so I
Yeah,
can't imagine a 27, almost three times the size of a
yeah.
big baby coming out. But to your point, does that need to come out when a 20?
Absolutely. Now, yeah, at a
It
certain
does.
point, when it gets super large, absolutely.
Right.
Like if
Yeah.
you're having problems with breathing and
Yeah.
moving and, and people calling you pregnant when you're not pregnant, then yes, just from a science
Yeah. Yeah.
standpoint, yes.
Yeah. And so I've got people who've had, sort of pot bellies or big stomachs, and they say it's their fibroids, and then it's kind of not their fibroids. And then
Oh,
there's other people who have those stomachs and it is their fibroids, and they can see significant,
I got
sort of,
a, I got a, I got an easy one for that. I tell every woman, because you hear that it's like, hey, it's the fibroids causing my belly I'm getting fat, I can't lose weight.
right.
If you can reach down and grab it, it's not fibroid. Period. Meaning,
Really?
if you could do this on your belly and you reach
Uh,
down and you grab it, that's
uh,
fat. That's not fibroids.
that's not
Fibroids are going to press hard, and it's a completely different feel.
feel.
No,
Yeah.
no grab, no fibroid.
Oh man, but now that's gonna bust a lot of people's
No,
bubbles. So,
I bust bubbles all day, every day, man. It's crazy.
But if someone's having a fertility problem and
Yes.
they have fibroids, the fibroids should be considered as a potential cause, right?
No, no,
No? Uh,
no, not necessarily, because two things could be true at the same time. You can have recurrent miscarriages and you can have I'm more shocked when I talk to a woman that has not had a miscarriage in her life more than I am ones that have not, you
yeah.
know, or that have, excuse me. So it's
Yeah.
like, if it's the body's way of natural selection. So
Yeah.
it's if you have something that's incompatible to life, then your body's going to find a way to, typically terminate even beforehand. And it's going to happen with or without fibroids. But the truth about fibroids is if they're not pushing into the cavity or close to the cavity, then they should not be causing a significant change in the ability for a woman to get pregnant.
Pregnant, right? It should have nothing to do with it because it's not even on the inside. That's where the baby is. I've
Correct.
struggled with people, being a man dealing with women in the office who might have had a miscarriage and be having a problem, and I've used exactly that explanation that this is just was a blessing. You hate to say it, but in this
Yeah.
case, it probably was a blessing, and I don't want to be insensitive. I didn't have the miscarriage, but with you, I mean, there are people whose my period was a week late. That probably, it might have been, and you normally have a 28-day period. You probably just miscarried. You know what I mean?
Sure.
But I'm not gonna. No sense in me telling you. But is there something we're missing when it comes to being sensitive about miscarriages? Do you think?
Yeah, I think we're missing a lot, and just understanding, to your point, just what the trauma that plays into a woman's. We can't have babies at all. We
Mm.
we can't get pregnant. If we could, I think the world would be an extinct. So so with that, it's
Right.
for a person that has that ability, it has to be traumatic things
Hmm.
happen to where it doesn't, you plan on it to. And so having the conversation, like you have the conversation of understanding that naturally things happen. There's an element of God in everything that we do, you know.
Right. Right.
And that is absolutely true as it pertains to pregnancy and birth. And when things happen that we don't anticipate, there's typically a reason for that to happen.
Hmm.
But explaining that in a way that is empathetic and that is informative, I think
Hmm.
is important, because a lot of times we're dismissive, just like dismissive about fibroids and say, "Hey, just get a hysterectomy," or dismissive
Right.
of, "She just had a miscarriage, get over it, just try again in 6 months." Letting people process, grief, process things happening, and then educating and having conversations so that they can now see why they're happening and be able to manage their feelings and their emotions better, I think is imperative for us as providers to be able to do.
Do that a little bit better job with that. Yeah, no, I think so
Yeah.
too. So I also wonder if, there are some people, some women who are just incapacitated 1 week out of four, in pain, in bed, wrenched over, going through pads and whatnot.
Hmm.
Um, and it's a monthly thing. And it can kind of, from the guy standpoint, it's like, okay, here comes hell week, and then
Hmm.
I'm not gonna have my wife. I'm not gonna have. She's gonna be in pain. I gotta try to be. And then once it happens every month in, month out, you kind of get numb in that empathy that we should have as a spouse. Not talking about us as providers, but I'm talking about the men out there that have people in their lives that are having daughters,
Hmm.
sisters, wives, mothers
Hmm.
that are incapacitated a significant period of time because of this. What sort of message do you have for them to try to better understand what they're going through? And sometimes doesn't the lack of empathy, the lack of support make the symptoms worse?
Yeah, I think so. It's It absolutely does. It's like I said, as men, we don't know what it's like, man. I think if we bleed for a day, we would go crazy. Just
I
imagine,
see it in my blood.
yeah,
I'm
just,
not. I'm brushing my teeth, Melanie.
yeah,
I got
right.
in the sink.
Yeah. Just imagine looking down and for 4 or 5 days out of the month, you just
No,
bleeding out of your joint.
no,
It's crazy.
the full
It's so right. Oh, it's like, oh hell no, absolutely not. So it's like, just having empathy and understanding that's something that we can't do, and that's something that is really, really, weighs heavy on the body that they have to go through every month. But to that
alone,
point, yeah,
almost
alone,
alone, right?
absolutely. You suffer in silence, and we are still expecting them to go to work, to
Mm,
be normal citizens, to do all of the roles and things that, we do every day when they're
right.
going through that, and it's insensitive to now or expect them to not go through things. But, to that point, even from provider standpoint,
Mm,
the level of common sense and the thought process is crazy. It's like, there are other things that can cause bleeding. There are
mm,
other things that can cause, PMS and other than fibroids.
right,
If I had a
right,
dollar for every time I had a woman that came to me that's having this horrible pain and horrible everything and had these super small fibroids and went to 5 doctors that told them they needed fibroid surgery or hysterectomy when they clearly have endometriosis, I would be,
right.
just a millionaire tenfold.
Wow.
It's just using common sense, as providers and educating patients. They go by what we tell them, and when we make it palatable and understandable and relatable for them to be able to get it, then it's better, but it's just saying crazy things and not really thinking about it, not having common sense behind it is really what I think is hurting patients and people more than anything.
When you mentioned that, I mean, so how many? When should a woman think about getting a second opinion? Well, someone's told them something. Is it just when you feel like they weren't listening, or if they say something that doesn't make logical sense, or when
Yeah.
should someone think about getting a second or getting another GYN or something like that?
Yeah, no matter what field of anything, even if we have no clue about it, we have a level of confidence. When I go sit and talk to a lawyer, 10 minutes into that conversation, feeling if they have feeling if they're trying to milk me money or
Right,
do
right.
something else. I have a feeling about what they're telling me, and my gut
Mm,
of guts is drawn
mm.
to what they're saying, or my gut of guts is saying run the
This is
other
great.
way.
Yeah,
And so
right,
to
right.
that point, with women, as you sit, men and women the same, as you sit in front of somebody talking to you about things that you don't know about, and sometimes using, language and words that you don't really know. One, they
Mhm.
shouldn't be doing that. They should be, understanding that you don't know these things and be breaking them down so you can understand them. So that
Right,
having the empathy and understanding is one. But then
right.
two, saying things that make common sense to you. And if your common sense meter is dinging red to you,
Mhm.
you absolutely need to get a second or even third or fourth or fifth opinion until you
Yeah,
feel absolutely comfortable.
yeah, and should a black woman be sort of deliberate about getting a black GYN or
Uh, I said, why not? Absolutely.
yeah,
I'm intentional. It's not to say that there are the people of other races that can care for us. Not saying that at all. There's so many instances in which people's true feelings about who you are and they think about you can get
mm,
masked very easy. Just look at
mm,
our society and look at our country. It's people that you wouldn't even think, but you
mhm,
go to the back conversations and things that they have. They tell you about what they really feel about you. So if you
right,
have the ability to do the research, and I tell everybody, social media is a phenomenal thing at this point. Do your research there. Don't just look at Google reviews. You could pay for those. Like
right,
if you're going to somebody that doesn't look like you, go to their personal social media pages, see what they're talking about, see what they
Right.
are. If they're doing things that are not in alignment with you as a person and you as a culture,
Mm.
probably not the best option for you as a provider. Just do your research.
Right, right. Well, that's great. We're talking to Dr. Pierre Johnson, the Fibroid Slayer, and he has slayed. How many fibroids have you slayed?
Bro, I don't
How
have any
is
idea.
it?
It's in the
It's
hundreds of thousands at this
hundreds
point,
of
bro.
hundreds of thousands. Outstanding. Located in Chicago, Illinois. See him on TV. We're going to see him on internet, on social media. Thank you so much for joining us. If they want to follow you, Dr. Johnson, on Instagram, or where can we find you online?
Sure. So in Instagram, TikTok is Doctor spell out Doctor DLCTORP 23. Both of those. Facebook is Pierre Johnson MD. Website is easy, www.fibroidslayer.com, www.pulse, of P, the number 3.org. We have a whole movement where we are trying to not only mentor, but provide the resources to young, driven individuals that look just like you and I to get to these spaces of excellence.
That's outstanding. Thank you so much. Thank you so much for joining us. Take care.
You too, man. Appreciate it.
None of the statements that I have made have been evaluated by the Food and Drug Administration. Genetic sequence multivitamins are not intended to treat, cure, or prevent any diseases. Furthermore, none of my statements should be construed as dispensing medical advice or making claims regarding the cure or prevention of diseases. You should consult your own licensed healthcare provider before starting any supplement, diet change, or exercise program, especially if you're pregnant or have pre-existing injuries or medical conditions. Remember, having a doctor is always your best option.